So you're in practice mode.
Okay. And stop.
Go.
All right. It's 8:00 and we are 7:00 Central. I'm in Eastern. So we are going to be talking about allergies. So welcome to everybody who's joining us. Really glad to have you here this evening. I am Dr. Carpenter and I'm here with Dr. Alan Trites. And we're going to have a good time tonight. We're going to talk about a lot of stuff. We'll go maybe a little more in depth on allergies than you've probably ever been before. You'll learn some new things for sure, things that will help you deal with allergies if you're struggling with allergies. And of course, it's spring, so it's allergy season. So we thought this would be the perfect time to get to do this with you guys. So in case you don't know Dr. Trites is also an applied kinesiologist and a functional medicine practitioner. And that's how we know each other. So we've gotten to be friends just because we have this common passion. And I've gotten to watch him work and learned a lot from him. And he's been in my office and gotten to work with me. And we just have had a lot of fun together and been sharing a lot of information. So here we are tonight to share some information with you guys. So I'm going to get started. Almost everybody who had suffering with allergies, at least someone who is, and it's really miserable. You get really sinusy, you might get itchy, you might get hives. So there's a lot that can go on, but really, do we know what allergies are? So Dr. Trites, my first question for you is to start with the basics. What are allergies?
Well, that's a pretty good question. If we want to go back into time, the first person who ever wrote anything about allergies, the first observer was Hippocrates.
Hmm.
And what he did it on was cow's milk. So that's, from a long time ago, cow's milk has been in our allergy world. So what did it do? Well, what symptoms did come with it, or what went with it? So allergies are one of the most common undiagnosed illness today. And too often, if you go to a conventional doctor, they'll go, I know you have an allergy, take this antihistamine. And then most of the people listening to this will go, well, what's my allergy? And the doctor will say, I don't know, but you don't need to know. Just take this, everything will be fine. But here's the problem. 1 in 6 Americans have an autoimmune condition. There are 2 million emergency room visits a year to allergies alone, and a fourth of those visits have a food allergy sensitivity. Mm-hmm. So I believe in Texas, you're getting some food allergy testing, and there's a reason why. Mm-hmm. If we go a little bit further, there are 73 million chronic respiratory conditions that are caused by allergies. 60 million Americans at least take some sort of allergy medication. And even so far, we can go into the autoimmune side or chronic conditions like arthritis, 43 million. And 250 of those autoimmune or arthritic are kids. That means people under the age of 18, which is something we never heard of before.
Yeah.
Then we go a little bit further, diabetes, which is also autoimmune, and an allergy. If you have an autoimmunity, you are allergic to yourself. So that falls into the allergy category, which is often being missed in our medical world. So lots of productivity loss. If you have any children or another loved one that has severe allergies, you're going to be at home with them. So what are allergies? Well, they cause many symptoms. The basic of it is it's inflammation. And what kind of inflammation is it? It's neurological. So it's neurological inflammation. What that means is your brain doesn't understand what it is. And in order to protect you, it elicits an immune response. Hence, the inflammation pathway is brought up, and you want to get rid of this thing. So the variations in allergies can lead to a ton of symptoms. It might be migraines. I mean, migraines or headaches are just vascular compromise. They squeeze down because you don't need whatever is going on inside your body to get to your brain. It's a good response. It just stinks if you have it. You could have sinus conditions. You could have asthma. You could have autoimmunity, eczema, heart palpitations. Even ADD and ADHD can be brought back into an allergy type system, or autism. And here's one that most people don't know. Osteoporosis is now autoimmune. It's known to be that. So we have to look at that. So what is an allergy? It's inflammation. It's neurological, but it can happen in a ton of ways, and it could be a bunch of symptoms. That's why it's so undiagnosed today.
Okay. So I think probably right out of the gate, you have just blown a lot of people's minds. So I'm going to just go back through a couple things. So basically what you're saying, an allergy it isn't just about like your sinuses or breaking out in hives with a reaction. What you're saying is is that an allergy at its most foundational level is actually a neurological reaction. Your brain isn't recognizing something as safe. And so your nervous system is creating this reaction. So that's the kind of new thing I think a lot of people have not heard. And the second thing is you're actually connecting allergies to a lot of other conditions that we don't think of as having an allergy component. So one thing I heard you say is autoimmunity is actually an allergy to self. Now that kind of makes sense, right? I think everyone who has an autoimmune condition kind of gets, my immune system's attacking me. Well, that makes sense of an allergy to myself. But you said some other things that I think are maybe a little harder to connect. So you said like osteoporosis, you said arthritis, you said diabetes, you said migraines, all have an allergy component. So
Correct.
can you just, like, connect that real quick for us?
Well, there are two ways that happen. Every disease state, if anybody gets bored, just go read any pathology book. And every disease state, it doesn't matter if it's celiac or gluten sensitivity or rheumatoid arthritis or even cancer, you have inflammation, you have a vascular compromise, you have a change in the blood sugar. Well, allergies come along the same way. It's an inflammatory response. They steal blood, so it's a vascular thing, and that could lead to a migraine if it's the head, or in somebody in their gut or leaky gut, they start to swell. Or if we do somebody that came in and said, hey, I've got a thyroid condition and all my inflammation is going to my gut and my thyroid, they have cold hands and feet. Why? The inflammation is in the thyroid and in the gut. Yeah. So it's just the standard physiology that happens, but a myriad of symptoms that goes with it.
Okay. So along those lines, back up. So we're understanding now how, because it's a brain reaction in creating inflammation, it can connect to other conditions. So with the inflammation and the change to your blood flow, it can create a migraine. With the change that it makes to your blood sugar, it can be related to diabetes. So we're starting to see those connections. But are there like symptoms, not just conditions, but are there symptoms that would be telling people that you're actually having allergies that maybe they don't know about?
Well, yeah, if your body has taken away its normal response, other than fatigue or an itch, or even a runny nose that might go with it, there can be a ton of other things. You might not be able to fight off colds because your immune system is bombarded. You might not be able to digest foods or have an intolerance to food, or maybe don't even crave the good foods, because when you have an inflammatory response, your body is actually in a fight or flight mechanism. Mm-hmm. So when you're in then let's say it's just a general one, but let's say it's long-term and you start getting a ton of these different types of allergies, and we won't go into the detail of that just yet. But what do you have to do to survive when you're in fight and flight? Your body's going to survive off of sugar. Are you going to make the proper amount of energy you need to repair and digest? No, you're in an inflammatory response. So you're going to make 2 units of energy instead of 38. And you're not going to necessarily digest well, because if you're in a fight or flight, most people pee and poop themselves or throw up and get the heck out of the situation. Well, that's why the digestive system slows down too. Mm-hmm. So it's not just the typical, I've got a runny nose or I itch. There are many other things that can go with it. And then when we look at the difference between kids and adults, mm-hmm. if a child has allergies, my alarm bells go off big time. And it'll make sense to you in a minute. As we age, we expect that our immune system and our repair system will break down. I mean, that's why we have a change in our skin tone. That's why we get wrinkles or freckles or moles, and our hair starts to change color and shape and even the consistency of it. Kids don't have that. So why in the world would a kid have an allergy? They haven't had their immune system break down. Mm. But if kids have an allergy, their immune system is under a lot of bombardment. We got to figure out who is turning it off. Is it something in their environment? Is it something they're eating? Is it something in their genetics? So I take a lot more interest in a child that has allergies than somebody that just got them for the first time and they're 50.
Okay. That makes a lot of sense. So maybe a little more expected with adults, but with kids, it's a real sign for you that something's going on that needs to be investigated. So don't Take it lightly. Yeah. I'm already, as I'm listening to you talk, I'm really kind of getting, I think most of us think, it's just my sinuses, just runny nose. I'll just have some Kleenex and I'll take some antihistamines and I'll be good. And we take it pretty lightly. It's just spring, it's fall, it's going to be expected. But what I'm hearing from you is it's really a big deal that you don't want to take this lightly. You want to figure out why you're having a reaction. And I've heard you say there are 80 ways you can be allergic to something. So
There are 80, yes, there are 80 ways to be allergic to something. So we know that we can put something on our skin, let's say poison ivy, poison oak, that's a topical. We know we can breathe stuff that's inhaled. We know we can eat something that's ingested. We know it can be injected inside of us, let's say a mosquito bite, and then we have an infection or a tick bite. We can even have electronic devices or electronic, let's say even a computer that can cause a rash. Some people can go outside in the sunlight, and the light itself creates a rash. That's an allergic response. It could be hormonal. It could be you can't metabolize something. It could be something toxic, and even vibration. So if I run my fingers down a chalkboard and it irritates you and makes you sick, because some people get very, very nervous and sick, agitated. That's what's happening with these kids who have ADHD. It's a neurological response. Are they really allergic to the chalkboard? No, they're allergic to the vibration. Their body's creating inflammation, which in their case upregulates their body, and so they get hyperactivity out of it.
Interesting.
So you combine those different ways times the 5 different antibodies, and you get up with 80 ways to get allergic to one thing.
Yeah. Okay, so you're actually saying sound can
Yeah.
be an allergy.
Yeah, that's because it's neurological.
That's interesting. Okay. So, as we're hearing, this is kind of more serious than maybe we all thought, and it's maybe a little more involved, more encompassing than we thought. It's our neurological system. It's inflammatory. It can affect our digestion, all these different things that maybe we didn't know. Let me ask you, is there a way that you can actually get over your allergies?
Oh, I believe so. If we know what we're dealing with, and we know what your genetics are, and we know what you're eating, that's a big deal. I mean, the big deal is neurotoxicity. So the first studies that came with it, and you can do this at home if you want to do this with somebody that are willing to do it, or with your kids. It doesn't matter.
Yeah.
You cut up an apple and an onion, and you blindfold somebody, and they will smell the onion, but you feed them apple. They will tell you 100% of the time, I'm eating an onion. Why? Because we taste with our noses. Because the nose has the olfactory that goes right to the brain and says exactly what's going on. That's how we respond. We don't actually, it doesn't go into your stomach, or you don't look at it. You actually taste it first, which tells your brain what's going in your mouth and how you're supposed to digest and go with it. It's neurological. So food manufacturers are very aware of this as well. So they can add what's called excitatory toxins. That's your aspartame, your monosodium glutamate, which only has about 40 different ways you can make that now, to make it excitatory to the brain and say, hey, I would like to have that again. It's not uncommon to find 100 different chemicals that are actually in a loaf of bread. And these foreign ingredients are foreign to the body. How does the body tag it? So when you smell it or touches the tongue, goes, I don't have a clue what this is. When it hits the stomach, I don't have a clue what this is. So you'll create an inflammatory response in form of an allergy. The same goes with the altered seeds. I mean, we might jump up and down and say GMO is bad, GMO is bad, but here's the deal. They put pesticides, herbicides, and fungicides inside the seed. And so when that comes out, you're actually touching it. So the EPA is well aware of the 65,000 chemicals that they say is safe for us, but they're also well aware that those are causing issues. And so that's what's considered hidden exposures. And we don't know about these necessary environmental triggers until we start asking questions. And the biggest thing we want to look for within your body is what's causing what's called oxidative stress. We don't want to oxidize. So if you go back before bumpers were plastic, they were metal. And when they oxidized, they rust. The rust appears. So if your body is rusting from oxidative stress, you're going to lead to more allergies because there's a breakdown. What can cause that? Hidden infections, such as a bacterial infection or a viral infection. Food, these environmental sensitivities that are the chemicals that go in. Poor diet. Maybe you have a gene that doesn't work. Maybe you have a hidden infection of the bacteria, virus, fungus, yeast, or parasite. And maybe you have an autoimmune condition where you're just inflamed regardless. And so one of these little things just triggers you and off you go. And so that's when you break down, you get a health problem. That's when you end up getting autoimmune, or worse, you can't turn off what's called oncogenes. In fact, we can go even further than that. Cardiovascular disease is essentially oxidation within the arteries. And a lot of that is due to an inflammatory or autoimmune or allergic response.
Okay. So you said that you think we can get over allergies. So let's talk a little bit about how do you get tested? How do you find where is it coming from? How do you actually work on it and get better? Walk us through kind of like the conventional system, how that would get treated versus like the functional medicine system, and what the differences are in the two approaches.
Well, the differences are there's a if I go into a traditional, let's say, allergist, they may run some blood tests. Most of them actually do today, but a lot of them still do skin scratch tests. And since I've ever started studying this in the early 90s, the New England Journal of Medicine puts out publication after publication. I couldn't tell you about this year, but I do know about the last few years about the skin scratch test. While insurances pay very wonderfully for them, and that's why they typically run them, because they're in the managed medical model where you do file insurance. When I put something underneath my skin, I hope it elicits some sort of response. And it may not be allergic, but it's inflammation. That's a normal response. So is it very valid? No. Is it very reproducible? No. But so then they run the next test that they run. And most of your allergists that I've seen, and very rarely do they run anything but this, is what's called an IgE. Mm-hmm. So that's an antibody for anaphylaxis. These are the people that have peanut allergies. These are the people who have shellfish allergies that swell up and they carry an EpiPen. That's pretty understandable. They need to have that. But when it comes to long-term chronic disease, health, longevity, and more importantly, anti-aging, you want to know about what is really inflaming your body. So there are two other types of antibodies, IgA and IgG. Typically reserved, IgA is for the gastrointestinal tract. It can be in your nose. It can be in your up in your lungs, but very rarely does it ever get there. But for the most part, it's in your digestive system. IgG is the one we want to know about because it typically gets out and causes systemic inflammation. This is the people who have the migraines. These are the people who have chronic autoimmunity. We're checking IgG antibodies for that. That's the more conventional. We can get into other ways that we can test for it, whether it's a blood test. We can check to make sure that your saliva, that you're actually making enough immunoglobulins that you can actually have a positive test. Because there are so many things when it comes to blood tests that are called specificity and sensitivity. Specificity means can I find what I'm looking for, and sensitivity is specificity, can I find what I need to find, and sensitivity is how many times in a row can I find it. Yeah. So a lot of these there's many different labs that run it, but some of the labs, they don't have very good numbers on the back end. So if I ran a blood test for somebody on this lab and I ran the same blood test over here, I hope I get the same number. We don't always find that. So Dr. Carpenter has found a good lab, and she uses labs that have those two high numbers. So what we get is what we're going to get, and if we rerun it again, we're going to get the same thing. I have seen a lot of doctors who just take whatever they can get their hands on, but of course they don't come from the background of pathology, so it's not taught in school to ask for those two things. You just take the lab's word for it. But that's kind of why we stay away from those. I will back up a little bit because I did say something about a peanut allergy. So I think it's prudent to explain how this peanut allergy is such a big deal now, where it wasn't 20 years ago. When Dr. Carpenter and I went to grade school, I had peanut butter and jelly. That's what my mother gave me. And then about the age of 5, she said, if you want to eat, you make it yourself. Well, that's easy to make as a kid, but good luck taking that to school now. Well, why is that? If I give you a vaccine, I need to put it in some sort of oil. And so most of the oils that are used are nut oil, and a lot of those are peanut allergies, or peanut-based oil. So if I give you a vaccine, my idea with a vaccine is to hide within the immune system. This is what an allergy shot is too, by the way. And then elicit a response. The idea is that you get an antibody to something so that when you're exposed to it again, your body knows what to do with it. So if I give you a vaccine, you could get those environmental hidden triggers to the peanut oil or the mercury or anything else that's in there, the detergents. And then all of a sudden I get exposed to a detergent, and the detergents are very close to what we use for our clothes. And the peanut oil is peanuts. So here all these peanut allergies are just going on and on and on and on. So that's really what has contributed the most to not being able to have peanut butter and jelly at school, is really a vaccine-related response. And the only way we know to turn that off is to turn off a pathway called NF-kappa beta. There is no medication that we know that I can find that I've been looking for that can actually turn that off. And in our world, we use two products. One of them might be a type of resveratrol, and one of them might be a type of sucralfate, or what's from turmeric. The very last part of that, for those who are taking a medication for allergies, and this goes across the line, whether it's Claritin, Benadryl, Allegra, I don't care. They all fall into a family called anticholinergic. So in 2000, the year 2000, the British Medical Journal discovered that every single one in the class of anticholinergics crosses the blood-brain barrier. Now, why is that important? It's because if you take it, it gets into your brain. Well, we would hope that the brain's immune system would be upregulated and take care of it. And it could. So if you need to take one because it's just you have to get through an ordeal or whatnot, okay, I get it. But let's get it a little bit further. The Journal of American Medical Association, after a 15-year study, produced last year that there's 1,000 times increase in dementia for those who take anticholinergics.
Wow.
So when we see that, and that's one of our fastest growing conditions and most expensive, it's only $150,000 a year to support that if you have somebody in that. We probably should be looking at some more, we'll call it bioprotective or conservative ways to dampen the immune system and to manage allergies so that we don't have to take anticholinergics and we don't have some of the responses that come from having just common allergies.
Yeah. Okay. So I know this is going to hit home for a lot of people because most people, when they're really struggling, like how do you function? How do you get up and go to work? How do you take care of your family when you're struggling with sinuses and allergies? You're going to go to the drugstore and you're going to get Benadryl or Claritin or something. But what you're saying, this is from the New England Journal of Medicine, that they're finding the people who regularly use these over-the-counter drugs have 1,000% increase in their risk for dementia. That's stunning. That's really huge. Okay, so this is going to be really important. Talk to us about other ways you can handle this that are safer, that don't have the same risks, but still are effective so that we can function.
Well, first thing is there's a saying that I really liked that came along that said, when it comes to foods, the less doctored your foods are, the less doctoring you'll need. And I thought it was a cute saying about 20 years ago when I first saw it. And after about 90,000 visits, I'm committed to it. So it does make a big deal. I don't think Dr. Carpenter and I would really be busy if everybody had their own garden and their own cow. I don't think we would, but that's not reality. So what is reality is that there are clean food options and there are ways that you can cook and eat and actually still be happy with what I call it neuroexcitatory of the tongue without going to things that actually make your immune system or elicit an immune response. It can be done. And, for the severe cases, for those people who have to do breathing treatments or they have a neti pot, we can insert things that are natural that help boost the immune system or boost what's called the detoxification, which is called glutathione when they do that. Or we can make the body make it so you can start to break those things down. We do have techniques to have anti-inflammatory. Of course, we can't do everything for you and we're not going to live with you. So there will be a plan in place when she sits down with you. Here's really what's, here's your hammer. Let's take some of the hammers out. And when we get these down, as you build your body up, your tolerance to these will come higher. And that's what we're finding with genetics. When we find that there is a gut disorder and somebody is actually gluten sensitive, if we know what the genetics to those are, and we repair the gut and we do some of these, and I think they're really quite simple. If I grew up in a world that all I ever had is fast food, okay, this might be crazy, but most people that walk in the door aren't on that program. And they'd probably be a bad fit anyway. But my worst case of this was a guy who was drinking 20 pops a day. Because I understand neurology and what's called, my first degree was molecular and cellular biology, I can't take this person down to 2 a day on pops. It's impossible. Same with smoking, same with caffeine. There are receptors that are there that are too high. So we start slow. We take away, let's try 18. You're actually having a conversation with somebody. Let's try 18 pops today. It's just, blows your mind, but that's really how you step them down.
Yeah.
And when you do that, you're boosting the other side. And so these two sides come together to where now their health is finally passing and going beyond it. Of course, one of the things we always like to check on these people is what's their yeast, because within the body, you have normal amounts of yeast. Yeast on the lungs is called asthma. Yeast on the brain can be forms of dementia. Yeast in the gut can be a ton of things. That could be muscle aches. That could be a lack of focus, depressed mood. I wouldn't call it depression, but it could be a depressed mood. Sugar and salt cravings, constipation, insomnia, diarrhea, itching, impotence, shortness of breath. I mean, this yeast that goes on is such a big deal. Now, why do we ever want to know about yeast? Is because if you have too much yeast, and what a yeast is a single-celled fungus. So where does fungus like to live? Moist, warm places. So think of all the moist, warm places you have in your body. You got plenty. That's where yeast hang out. But our immune system usually keeps it in check. So if we feed it with our typical American diet, which is called SAD, which is the standard American diet, which is high in carbohydrates, it's like putting gasoline on a fire. There's a huge explosion. Well, every organism in your body, and you have trillions of bacteria, and your yeast and your own cells go through a cellular respiratory cycle. You know this, as we breathe in oxygen, we breathe out carbon dioxide. Well, everybody else does the same thing in their own way. Well, when yeast have their carbon dioxide come out, it's something called acetaldehyde. This is a big neurotoxicity. So not only does the body have to deal with it, if the yeast gets too high, it starts to, we'll call it hijack what you're eating. So let's say you ate a pea, and there's a little bit of protein, a little bit of carbohydrate within a pea casing. Well, your bacteria know what this is. When you touched your mouth and breathed it and put it on your gut, your brain goes, oh, we're eating peas. Got it. Let's break this down right. But now there's too much yeast that's in there. You don't break it down the same way. And if there's some sort of swelling or toxic issue that's in the gut that allows a leaky gut, now it's in the bloodstream, you have a broken down piece of pea that the body doesn't recognize. What should it do? The smart thing for it to do would be to create an illicit response, which is an allergy. So allergies are the right thing that's going on, but sometimes it's the wrong thing and the right application on how it got there. So we do want to look at what yeast can do, because in many cases, yeast causes a toxic issue. So we'll see liver enzymes at high. And if you have too much in the body, where do you have to put toxins? You put it into your fat. So then that makes it very hard to lose weight. And then when you do work out, you feel like junk. So we look at all that.
So I heard you earlier saying, one of the things that can kind of lead you into having allergies is having a hidden infection. And now you've brought up the topic of a yeast infection. People know of this as candida. But you're saying that if you have too many yeast in your body, because you should have a little bit, but if you have too many, if they're overgrown, that this really sets you up for allergies.
Correct.
Yeah.
That's a big deal. So what's the cure for yeast? You can take a yeast, anti-yeast thing, but then what if all the yeast die? Then we have a problem. What if all your bacteria die? And you may have heard of this when anybody's gone to the hospital, they've had too many antibiotics, they get this what's called C. difficile.
Right.
Because all their normal bacteria are gone. So this pathogenic bacteria says, hey, free room and board, let's go for it. Yeast are no different. Or any worm or anything that could possibly get in there are no different. So when we eat properly, and it's generally 2 to 3 servings of what's called green leafy vegetables, they have a mineral, or it's not necessarily a mineral, but a compound in there called manganese. Sorry, not manganese, molybdenum. And if you have the proper amount of molybdenum in your body, you keep the proper amount of yeast waste in check. So the acetaldehyde that we had talked about that's neurotoxic, if you have the right amount, there's a balance. There's a reason that we're supposed to eat certain things in a certain amount. It's not just about what maybe a research project or a government told us. There is a reason for most of the things that happen physiologically. So what we do is we find out, well, how many is it that's going on? Now we can do a blood test, we can do a stool test, and we can do a kinesiology test to find out how many of these molybdenum pills would you need a day. So in a normal world, we don't typically give molybdenum, so because it's not necessary, but it's used as a test. And in the lab, we used to use it as a reagent as well. So we can do a test, and the normal is below 10. The average American is around 68. And then when you get above 100, we have a lot of problems. So we like to monitor with our allergy patients, because if they have yeast as an underlying infection, really can't get to the rest of their stuff until that's taken out. So that's kind of where I start. And if that's okay, then we go look at other factors or then I might even get to the genetics. I don't even jump into genetics until the yeast is clear, because what's the point?
Right.
I give you something, now the yeast is still going to steal that too.
Okay. So I'm going to back up in a second. So if people want to find out if they have a yeast problem, you said you can do some labs, but if they come into the office, they see you or they see me with the AK, the testing that we do in the office, we can actually find out if they have it. And I used to just say yes, no, but what I've learned from you, you actually quantify it, and you give people what you call a yeast score or a yeast count. So someone can come in any visit and go, hey, Dr. Trites, what's my yeast score? And you can actually tell them how high it is, how severe it is in the beginning, or if they're working on it and it's coming down, you can tell them, here's where you are. So you said around 10 is kind of what you really want to be. You don't want 0, but you want about 10. You said most of us are around 60 because we're not having the best diet. But tell us, give us an example of maybe somebody who's had sort of an extreme case, and like what was their score, and then what did they do to get better?
Well, we had a couple cases. I had a patient that came in after, I'll just make it easy. It was an infection within their bone. It's a really long name. So they got to go to the hospital, 6 months in ICU, bags of antibiotics.
Yeah.
And then, of course, everything is fine. You can go home, but all these symptoms arise. So we just did a molybdenum count, and it was, it was closer to 2,000. Okay. And a lot of the symptoms that were arise that had been there were neurological, but none of the neuroscans, the MRIs, the CTs, nothing with that was there. However, when we did our neuro exam, there were certainly things there. And by the way, that's why I like to do neuro exams with anybody who's autoimmune, is because there's a whole new world, like where there's neurologists and psychologists, there's autoimmune neurology. It's specific to autoimmunity, which is an allergy. So in our world, we still want to know, remember, an allergy is a neurological issue. So we want to see what the neurology is doing while we're monitoring this. So that one took about 8 months. That was our worst case. It was so high and they had gone through so much, but it was slow, because in our conservative world, a lot of my colleagues will say, okay, let's say we have a blood test and we have yeast. Let's go give you something for it. Well, it's the same in the case of a bacteria, or if you had parasites, or even a really nasty virus. If I give you something that's antiviral, antifungus, or yeast, they die. Well, we know that yeast, as they die, they put off a neurotoxin. So what would happen if we did that with somebody like that? They go into a neurological, or Herxheimer is mostly the time, but they could go into convulsions or even a seizure. We're not going to do that. So that's why I kind of want to qualify and quantify. What is our yeast count? What are we doing with her? And if it's a pretty high, most of the time we start dietary. I take out anything that we know that has been provided to us through research that can slow down the growth of these guys by not feeding them. And as we get further along, we start adding, and you'd be surprised how fast just diet alone will knock these guys down. Then we start adding things to help the immune system. Then we have things to start getting the yeast to die. And then we boost the immune system again, and then we boost the digestive and detoxification system to get rid of these things until we get to something normal. And then we go back and see how are those neurological things going on. And for the most part, most of them dissipate. So that's our worst case. Most of the times that where I started with this was actually with young athletes. You've got and of all places, it was asthma and distance runners. It's really hard for a distance runner to run and then go. They don't like that. And so we discovered that for most cases, it's yeast on the lungs. So again, the same process. Well, how much is it? How do we change our diet to get there? What can we do to kill it? We monitor it, and eventually those side things will go away. So they don't have to take an inhaler when they go for a run, and they don't have to take their anticholinergics, which doesn't help in school. And then we make sure that they don't have things called a cross-reactant food. So I just recently heard, I had somebody in the office, and they thought that this gluten thing was a fad. And I didn't take offense to it, but it's not. So there's too much research to ignore it. And so there's this thing called a cross-reactant antibody, and yeast is notorious for creating this. So I'll bring out this little, we'll call this gluten. It's not. It's a magic marker. But let's say it gets past the gut. This down here is my gut. And now it's in my bloodstream and cruising around. So the body goes, oh, look at that. We better make an antibody to it. And I bound to it. So I hope you can see that color. It's black.
Yeah.
And now I've got a leaky gut because these yeast break down my bacteria and they break down my mucosa and they create an inflammation within it. And so now food leaks out into the body. And so now I have a different color, green. We'll call this milk. And it's not cruising around. Do I have a milk allergy? Well, not just yet, but I still have that gluten allergy. And guess what? It binds just fine. Did I eat any gluten? No. I had milk or dairy. And we know that within the gluten world, there could be 20, 24 different antibodies or cross-reactant foods. So it comes down to the testings, what we can or what we have that's going on. And there are some further tests that Dr. Carpenter can run to go find those out. But I think it's imperative and important to look at what's going on there. I mean, just up here, our Children's Mercy Hospital in Kansas City has done a fabulous detailed work on metabolites in autistic kids, how big school failure is in kids that are taking meds that are creating a yeast condition for hyperactivity. If you've had more than 10 ear infections, what is happening within the yeast within their gastrointestinal tract, and is there a correlation? Well, yeah. I gave them an antibiotic. What does an antibiotic do? It breaks down their bacteria. The antibiotic doesn't care who is there. An antibiotic is actually made from a fungus. So fungus, really, if you remember, yeast is a little one-cell fungus. It wants to kill it. They compete. So we have to monitor and keep those two things in balance. What else can affect it? There are a lot of medications that change the pH within the gut. Our bacteria die. Yeast I call yeast college students. You got free room and board. They're going to have a party. So we got to be careful with that.
Wow. Okay. That's a lot to take in. So really, the world of allergies is way more complex than any of us probably ever appreciated. And the connection with yeast making allergies worse also is way more complex than probably anyone appreciated. I think most of us probably have heard of like candida infections, and you just take an antifungal and you're good to go. But you're saying that a yeast infection can actually kind of create anything, including allergies. And if it's severe enough, you can't just simply just take something to get rid of it, or you can suffer some consequences. It can be a little too extreme. You have to be conservative and careful and get the ball rolling, maybe with just some diet changes, less sugar to feed the yeast, let them die off a little bit naturally before you start adding something in if it's bad enough. And now you're also connecting all of this to foods and food allergies. So I think most people that I work with anyway, mostly they're autoimmune. And so we've already had conversations about, hey, if you're autoimmune, you have to find hidden infections. You have to find sensitivities to food. And we have to see if you have a leaky gut. Most people have already heard that term. They know that it means that your intestines have become permeable. And so things that shouldn't get through the lining into your body are, and it sets you up for more autoimmune conditions, more food sensitivities. And now you're saying that allergies and yeast are both connected to leaky gut.
Connected to leaky gut, connected to weight gain, connected to hormone imbalance, connected to fibromyalgia, connected to chronic fatigue, the list is very long.
It's like there's nothing it doesn't touch.
Correct.
Yeah. I've even heard you talk about grinding your teeth. If someone comes into the office and says to you they're grinding your teeth, that you tell me one of the things that you're thinking about if they're grinding their teeth.
Well, I always default to what's my molybdenum count at that point. I want to know what their yeast count is, because 9 times out of 10, that's where we're starting, because it's a neurological response. That's an acid-aldehyde reduction. You're usually asleep, and this stuff is taking off on it, so it creates a contracture. That's what typically grinding the teeth. I mean, there's other reasons that could be there, but that's where I start. I mean, we still might have some tissue damage, but it might be tissue damage because you're grinding your teeth.
Yeah.
Before I go to some sort of head trauma or a spinal cord injury, but that's why we run usually 120 different tests when we're in the office to find out where is this coming from.
Yeah. So earlier, you said that you do think that allergies can be healed. You can get over an allergy. So it sounds like one of the very fundamental things that you would check someone for to help them recover would be a yeast infection.
Correct.
Okay.
This is a typical yeast infection that's pretty much in the media. This is just, you have single-celled yeast inside of your body everywhere. I want to make it clear. Yes.
Naturally should be there, but they've just overgrown.
Correct.
Okay. So we've talked a little bit about things that you would do to help allergies and just deal with the symptoms, kind of a Band-Aid thing, but also how do you heal in the long run? There's two different things. And I know in my office, we use some natural antihistamines, so different from the anticholinergics you mentioned, like the Benadryl, the Claritin, that come with the increased risk of dementia, which makes like ADHD worse, cause their problems. So with natural antihistamines, we also use homeopathics, which are very gentle, but they help sort of desensitize people. And I had lots of people have amazing relief from allergies doing one or both of those maybe together.
Yep.
Lower histamines, lower reactions with the homeopathics. So to me, those are kind of some of the basics. You're saying, eating a good diet, a cleaner diet would help. What if those basic things aren't enough to help people get relief from their allergies?
Well, there's still some other testing, but if we remember, I started with it's neurological.
Yeah.
So what are we doing in the neurology to make it work? So there are some ways to upregulate and help that along. So for instance, the first time I learned a lot about autoimmune neurology, we also learned about, and don't try this please, how to trick your life insurance policy if you have high blood pressure. If you push on your eyes a little bit, there's a response. It's a vasovagal response, which will actually lower your blood pressure temporarily. Is it there? No. But your blood pressure will be low for a minute. So understanding how the nervous system works, whether we go to a gargling or a balancing movement at home. But in 2004, and this is really ironic because we technically are chiropractors. I know we don't do typical traditional chiropractic work, but the Journal of Orthopedics and Surgery came out with that when you have a chiropractic adjustment, and that can be wide, but typically of the spine, you can reduce allergy symptoms. Why? And the conditions that they looked at were contact dermatitis, asthma, hay fever, and joint dysfunctions due to an allergic response. So anybody that has rheumatoid arthritis, that's an inflammation. When you balance a pelvis, the pelvis is responsible for moving blood throughout the body properly. Doesn't need to go to the gut, doesn't need to go to the lungs, the heart, or the brain. When you balance that properly, you have more blood going to the brain. Well, who runs the nervous system? The brain. Oh, there's a lot of connection to the gut as well. But if you have the blood going properly between the two of them, they get a communication. So for a long time, I had kind of stepped away from most of the structural work, but in relearning the autoimmune neurology, I rediscovered how important it was to make sure that those processes are working because it's neurological and I need the nervous system to wake up. And there's only two ways it's going to go, whether it's a nervous system or the immune system, it's going to be when it's off. It's going to be too little, which means I have no response to any type of, I'm scaring you, you're just sitting there. or I scare you and you go running and running and running and run away. That's too much of a response. The immune system and the nervous system are no different. When they're out of balance, it's either too high or too low. So we need to find out which are you, work backwards, whether that's with a physical thing or a treatment in the office or with supplementation. Those are the three ways. And I agree with Dr. Carpenter. Well, homeopathics are there. There are also herbals that aren't anticholinergic that can do a great deal. And if we know a little bit about your genetics, we can go even turn off the histamine response or go even further back to help the body from making histamine. And for those of you who are gluten sensitive and have allergies, keep this in mind. There's a ton of studies out there right now that histamine plus gluten equals a zonulin response. And what that means is that inside of your gastrointestinal system, large intestine and small intestine, you have a protein that sits on the outside. Well, not necessarily that we'll call it the whole, but on the outside. And if those two guys meet, histamine and gluten, inside of your digestive tract, they go irritate zonulin and you flood your intestines with fluid, which means you've opened up and created more of this leaky gut or permeable membrane. So it's imperative to stay away. It's kind of like somebody told me, when you have those cases of those two, it's sort of like being pregnant. You cannot be partially pregnant, just like you can't be partially gluten-free when you have those two responses going on.
Okay, that's more big stuff. Because I know a lot of people do struggle with gluten. And they also struggle with allergies. And when you have allergies, you're having histamine responses. That's what our bodies are doing, is to create the mucus or to create the hives. That's a histamine release. And I've heard you with patients explaining when they have food sensitivities, that they're having a histamine reaction in their guts, in their digestive system. And now you're saying that histamine in the intestines, we now know releases or contributes to zonulin changes, and that begins the beginning of leaky gut.
Correct.
So being allergic to a food like gluten and having a histamine release leads to leaky gut or makes it worse.
Yeah. Zonulin is not just the gut. You can have leaky lung. That's called asthma, COPD, respiratory conditions. And the worst is leaky brain. So in the case of yeast, you might just get brain fog. But if you have the rest of these that are going on, that actually opens you up to bigger issues. So if you have in your background genes, Alzheimer's, Parkinson's, dementia, and other neurological conditions, you just open the door. If you don't have your blood-brain barrier intact, nothing's stopping anything from getting in. That includes pumping gas. If you go out and pump gas and you have these two things going on, it's getting in you, the vapors that come off. If you go paint, it's getting in you. So people who have these conditions will often put, I'm sensitive to this. This perfume makes me nuts. This, when I do this, I can't touch this anymore. Now I can't wear pants because the nickel bothers me on the button. You got that. That's how it happens. You weren't born with it.
So earlier I was asking you about kind of different symptoms of allergies that people might not think about, because typically, runny nose or itchy, you know allergies, you think allergies. But what I just heard you say is, if you have a sensitivity to fumes or a metal, trouble breathing, like even those are symptoms to you of an allergy, that they should get checked for an allergy.
Yes.
Okay. All right. So I think a lot of people are probably going to want to come in and get checked for allergies and yeast for sure.
Definitely yeast.
Yeah. So something else I want to back up. You mentioned genes a couple of times. I know we had a great conversation, a great webinar a couple of weeks ago on genes. And a lot of people these days are really interested in their genes. They're able to get testing done, know what their genes are. When you're evaluating people with their genes, are there a couple of genes that you would look at specifically and that would be related to allergies?
Yeah, HNMT and histone was what makes histamine. And so if those two are there, we're going to be, we know that that's your big trigger. And sometimes they need, so when it comes to the research, they'll give us like 30 things that have shown response to people. okay, for this one problem that you have going on, should we give you the 30 things that are on there? No. That's why Dr. Carpenter used muscle testing to find out what the nervous system wants to react to the best. Otherwise, you walk out with those 30 things for that one problem. We would like to give you one thing for that one problem and then find the other problem and then give you one thing for that. So that's the big one. We still look at the vitamin D receptor because if you have, and goes back to those kids, when the kids have the allergies, the probability of them getting more allergies or even worse, an autoimmune self-allergy, is very, very high. So how would they get that? Most likely they have a vitamin D receptor. When the hormones get out of balance, we also look at vitamin D receptor, and who feeds into that is called the COMT. So they all kind of tie together. And then, of course, this is an inflammatory response. So if it's taking all of your energy, well, some people can have allergies and just cruise along just fine. And some people can have allergies and they're just beat. So it all depends on how that body's making energy. So we look at what's called NDUFs, or how your body can make a unit of glucose or sugar and make it into something called energy, or ATP.
Okay. So all of this information was amazing and I think really helpful and probably really new for a lot of people. So I really appreciate your time spending with us tonight and talking about all of this. Just to kind of wrap up everything, I think everybody listening tonight would say this is definitely a bigger topic than anyone imagined. And one of the biggest things I think we probably all learned tonight is that allergies aren't just about your sinuses or your skin, that an allergy really is a nervous system thing. It's like a brain thing. It's a neurological issue. And there are a lot of layers involved in this. And so if you're someone who's struggling with allergies, there's actually a lot you can do. We talked about different herbals that you could take, herbal supplements that you could take, homeopathics that would help, some natural antihistamines. And you said one of the very first things that anyone would want to do is just have a really clean diet. Having a really good, healthy diet is going to make a big difference. So those are some really conservative, easy things to do. Beyond that, it sounds like you would also look at some genes, HMNT, histones, VDR genes, to kind of help people with some specifics about how the allergies could be affecting them and things they could specifically do for them that would make a difference in how they feel. I heard you say too that there's an immune system component and that there are things that can be done to help balance out and kind of dampen the immune response so things aren't so bad, people don't feel so bad, that you can bring inflammation down. And then the last thing I heard you saying is, because there is this nervous system connection, that actually getting structural care can make a difference. And people don't think about chiropractic and allergies, but because of the nervous system connection, getting adjustments, making sure everything's working right, can help calm all this down too. So there's a lot that can be done.
Yeah, there definitely is. And for those who are seasonal, we can dampen the immune system and help you out for the season. But what we're really looking for is next season. Mm-hmm. We got to get that going. And one of the things I didn't put in there was that your allergies are inflammatory complexes. It has to be cleansed through the liver. So we also look at, and that's why Dr. Carpenter runs blood tests and follow-ups to make sure that your liver is processing right. And there are some other things specific to allergies like N-acetylcholine or whatnot that we can help with the liver to help process these out. Do many of your patients have an issue with getting calcium, or they want to get it from cow's milk?
Yeah, most people feel like I have to have dairy or I'm not going to have enough calcium.
Okay, good. I 2 seconds. I know we're running low on time, so I wanted to address that because again, I started with the very first person who studied allergies 2,000 years ago was on dairy or milk. And so I get that often up here as well. Well, how am I supposed to get my calcium if I can't have my milk? And so I'll ask you a couple questions. So where does a cow get its milk from? Well, do you ever see a cow walk over to the other cow and say, hey, I'll take some milk? No, they get it from green leafy stuff. But what is really cow milk? What is it for? It's to get a small infant calf to gain 2,000 pounds and have a low IQ. So that's what you're supporting. But that's just the fun part of it. The calcium that's in cow's milk is as close to chalk, like from the old school chalkboards, as it can possibly be. It is very inabsorbable. You have to have a ton of acidic environment to get it in, versus something that has a green leafy vegetables. You can eat it with other things. You can absorb it. So the other side effect to that, unless you have your own cow and you feed it the right way, in order to make money in the dairy industry, and I know a little bit about this because of where I live and what's going on here, you have to give a bovine growth hormone. And when you get that, you get mastitis. And if you really want to get disgusted on things, go to a website called milksuck.com or milksucks.com, and you'll see how many white blood cells, or we call it pus, is allowed to be in milk, and that's okay. But that's why so many people get swelling in their throat or an ear infection for kids, is because their body is reacting to pus as it should to get there. So you'll be better off just having some green leafy vegetables and get a better absorption rate with a less response from an immune system. And for the women that are over 50, if you're worried about joint pain, this is from Harvard Medical School. They started in 1997. And they published in the American Journal of the American Medical Association for several years that there is zero decrease in fractures, hip fractures, or any other fractures in women over the age of 50 when they drink milk. There's no incidence if you stop drinking.
Wow.
So that's where most people are afraid. That's not the case. So milk isn't solving that problem, but it has a good ad.
It does have a great ad, and I think marketing has a lot to do with why we all think milk is so critical. I know in my office we talk a lot about how milk and dairy is one of the top 3 food allergens or food sensitivities that people deal with. It's amazing how people don't tolerate it well. And one of the funny things is, one of the ways we know people are reacting to milk is that they think they have allergies. They're all phlegmy and congested, and they post-nasal drip. They think it's allergies, but it's actually their reaction to dairy.
Correct.
Very common that we see this. Yeah, great. Well, thank you very, very much for spending the time with us and talking to us about allergies. And thanks to everybody joining us tonight. We're going to watch later on the replay. I hope that you guys have learned a lot. This was packed with information, so I know you learned something new. And if you want to talk to either one of us, if you want some help, if you want to get checked for your yeast count, if you want to have more help identifying your allergies or any of the underlying things going on, like leaky gut or immune system issues, inflammation, please come in, see one of us. Dr. Trites is actually going to be in Dallas in my office coming up end of April, sometime in May too. So you could see either one of us and we can help you out. All right. So again, thank you guys, and you'll have a good night. We'll see you later.
Bye-bye.
Bye.